are right in between, okay? They're your shock absorbers, essentially. So if anyone's ever seen an MRI where it says an L4, L5 problem, it's not a problem at two different zones. What you're doing is you're naming the disc based on the bones that it's in between. So for example, if you had an L2, L3 disc problem, which I'll talk about, it's really the disc in between L2 and L3 is how they name it. Because sometimes MRI reports are very scary. All right, and then right here it shows how the nerves come out. Right, so in your neck, what happens is the nerves come out of your spine and go all the way down your arms and hands. And in the low back, they come out and go down your legs. So this is where that spinal nerve comes out from the spinal cord. And this is the sciatic nerve, okay? So what happens is it comes out at L4, L5, comes all the way down your legs, and it will actually branch out into many different nerves that go down there. So if you guys can imagine your circuit breaker at home, right? If the power's out, you go there, you flip it. So think about your spine as your circuit breaker, okay? So if you walk up to that circuit breaker and you cut a cord that's coming out of there, you're going to lose every room that's on that cord, right? So that's the analogy here. So the reason that this shows as all red is that if there's an issue with the nerve at the spinal cord, it's actually going to affect all the way down, which is why people can have pain in their butt, in their leg, in the thigh, and the calf.